Now I request Dr. Sunila ma'am. Dr. Sunila ma'am. Professor Dr. Madhuri Chandra ma'am. She is the senior gynecologist from Bhopal. Dr. Malti Bhojwani madam, director from Malti Hospital, to chair the next session, and I request Dr. Jamuna Devi ji ma'am to highlight on urinary incontinence and HIFEM chair. Okay.
हाँ है एक सेकंड मैम एक सेकंड ये सीवी पर
Yes,
हाँ जी
ma'am.
मैम नहीं नहीं मैडम
Dr. Jamuna Devi ji ma'am, she is the senior consultant from the Yashoda Hospital, Hyderabad, and she is the chairperson of Aesthetic Health Committee, Indian Menopause Society.
Thank you, everyone. Thank you, Bhopal team, for inviting Dr. Anita. Anita Shah has taken a lot of pains to organize this, and Anita Srivastava has taken a lot of effort to organize this wonderful CME workshop. So I think we have heard so much about all the energy-based devices which are expensive, and all of us will think so many times whether to invest so much of money and on these energy devices. So I'm going to make it more interesting because chair is going to be a little cheaper than all those things, and you don't have to be there for telling your clients how to use it and all. And if you combine with the PRP treatment, it's more it works very well. And I think you all will believe that whenever we tell patients for Kegel exercises, and I'm sure nobody does. And I think this is one better option for the pelvic floor dysfunction. So the prevalence is so much. We see that there are almost 120,000 women undergoing surgeries for urinary incontinence each year. This is the consensus what I have collected. This is the recent data. And more than 120,000 procedures are done worldwide. And such effects, SUI effects, we see that 30 to 40% middle-aged women and over 50% of them are post-menopausal women. Then stress urinary incontinence among Indian women varies, and they have done a study and they found that 12.5% to 22% of women do suffer from SUI. Then population-based study was done in northern India, and they found that it is 12.5%. And hospital-based cross-sectional study was done. They have reported that SUI prevalence is 16%, and it can extend up to 22% among women. And studies have focused on the specific groups such as middle-aged, multigravida, and it is between 41 to 45 years, and the prevalence is 18 to 49%. So this is the magnitude of the prevalence. And actually the Procter & Gamble, they have done a study, and they found that they sell more of adult diapers than infant diapers. That shows that how much is the extent of the incontinence. So we all know pregnancy, childbirth, then pelvic surgeries. I won't go into all these details, aging and menopause and all these issues. And now added to this, we have lot of cancer surgeries done, which are damaging and all, and they need the muscles to be rejuvenated. So obesity, now it is one of the leading cause of in our country, and they do have lot of pressure on the pelvic floor, and they do have this incontinence. Then chronic coughing, and we see that lot of upper respiratory tract infections because of pollution, because of smoking. Then chronic constipation. This is another issue where we see these women having pelvic floor muscles become weaker. And heavy lifting, especially the occupational issues. In these situations also, there is a effect on the pelvic floor. Then surgically, we know that all these procedures can be done. And, but they have their own complication, intra-operative bleeding, bladder and urethral injuries, then post-operative complications. And some of the cases, they are not fit for surgery. And periurethral and bulking or agents and all this, these are all chemicals and they're short-lived. Then non-surgical, we say that lifestyle modification, and hardly, women do follow these things. Then weight loss reduction, then smoking cessation, and fluid management, and treat constipation, and all these things will take as the first line. And then pelvic floor training, as I said, nobody does this. Most established first line therapy for SUI is strengthening pelvic floor support, reducing leakage, and can be enhanced with biofeedback, that sensors to improve technique and all this electrical stimulation for those unable to perform these exercises independently. And I think that is the most easiest way. So this is the pelvic floor chair, strengthen, pelvic muscle, promote postpartum recovery, and of course as a beauty clinic machine. So it is a non-invasive, painless, FDA approved, then it is very good for urinary incontinence, then laxity of the vaginal muscles also. So how it does strengthen and rehabilitate the pelvic floor muscles, but contributes to re-establishing the neuromuscular control for treating urinary incontinence, and device can be used in both males and females. So how does it act? Technology is, it generates the electromagnetic currents and it forms a field. And when the person is sitting on that chair, on that field, the effect will be there, and it focused electromagnetic field with intensity up to 2.5 T, and penetration is up to 10 centimeters. So it can go up to that deep, and energy produced is directly vertical upward from the center of the seat, and it will stimulate the pelvic floor muscles. So the coil which is there in the electromagnetic is pulsed, and it's not continuous, and penetrates deep into the pelvic floor muscles, and induces stimulation of the pelvic muscles, which causes contraction rhythmically in order to strengthen them. So electromagnetic field passes in a non-invasive manner through the neuromuscular tissue and induce electric current, depolarize neuronal cells, and initiate action potentials. So that is why it is very easy and can be used for this SUI. So each session, patients can experience tighter and stronger, and they themselves will come back to you and say that I feel little better. Then, of course, hyphen treatment is painless, non-surgical, non-invasive procedure. Person just need to sit on it for a duration of 28 minutes, and during this duration, patient may experience contraction, relaxation of the muscles, and without any pain. Then this device equivalent to approximately 11,200 Kegel exercises in just one session. So the chair treatment causes production of new muscle fibers and protein, so that it enhances the neuromuscular coordination among the pelvic floor muscles. So indications: stress urinary incontinence, sexual rejuvenation, urge incontinence, erectile dysfunction, pelvic organ prolapse, vault prolapse, coccydynia, chronic pelvic pain. And this is the one chart, you should use it so that you will know how the person is, outcome is, so that you can have this. And success rate, you can see this. There is a very good success rate summary, and we see that though it is we need lot of longer term trials, because most of us do use it, but then we never keep a data. So all of us, if we pool the data, probably we'll have a very good data for us. Then contraindications, as already said, pregnancy, implanted neurostimulators or defibrillators, then cardiac pacemakers, hemorrhagic conditions, anticoagulant therapy, drug pumps, metal implants. Of course, you have to know what is the type of implant they are using. Then malignant tumors, copper T, heart disorders and fever. These are the contraindications. Then treatment protocol. 6 sittings are recommended at a frequency of 2 to 3 sessions per week. Each session is 28 minutes. Person sits in the chair, in the center of the chair, and you have to ensure that the pelvic floor stimulation, the operator confirms the patient's chair posture throughout the session and adjust the intensity. We have to check with them. When we are increasing the intensity, we have to ask them whether they are comfortable or not, and slowly we have to increase. Then screen pure SUI sheet, so that you will know what was the outcome with them. Then what are the tips? Person should be dressed comfortably, and person should not wear jewelry, and person should not wear jeans or thick clothing so that the penetration will be affected. Then remove credit cards and coins from the pockets, and person should remove iPads, watches or phones, as it is a electromagnetic energy, so that their devices are affected. So this is the chair. Now you can see that pelvic floor, angulation which was there before and after. And this is what happens before and after, and it is an evidence-based study. So 47% cure rate was there, and 65% have improved. Then high satisfaction was there, and we all know that it's FDA clear, and it is superior to basic stim in comparison. So advantages: better and bladder and pelvic floor muscle control is restored. It is painless, non-invasive, just 28 minutes, then no recovery or healing time involved. Then only one may remain fully clothed during the treatment. There is no change. Then significant improvement after a single session. They will tell that. They have found that 51% have said that there was an improvement, and there is you have to take it, how many leaks were there any leak, or was there any on cough, any drops were seen. So that way they said that it was 51% improvement. Then evidence-based, as I've already said, that 47% cure and 65% improved, and there was high satisfaction. So future directions, of course, stem cell therapy is there, improved minimally invasive devices, personalized treatment based on risk profile. Then we all know that SUI is very common, underdiagnosed. Not all will come for their issues, but of course awareness has brought, and we do see that many women are coming. Then surgery is a gold standard. If it is a refractory case, then emerging therapies may expand options in the future. So I think if your friends have chair, that all of you can go and sit for pelvic floor improvement. I think all of us will have this problem. Thank you for your time, and see, we bring smiles to these women.
May I ask a question?
Yes, please.
It was a very insightful lecture, and I wanted how many cases do you have used this chair?
Not many.
To what extent we can avoid the need of the invasive procedure, that is surgery?
Yes. See, it depends upon your selection. Now, actually, we have lot of doctors who are using, and their experience is like women coming to, especially obstetric cases. All of us do obstetrics. So after 6 to 8 weeks, we can ask her to come and sit, and probably, definitely, we will give an improvement with them. And after first delivery, a lot of women come and tell us that I'm not able to hold it. So those women we can ask, and there is no harm, and definitely they have seen lot of improvement. Actually, one of the doctors, they have experienced that one lady came to their outpatient, and she said she was leaking. Actually leaking. So he said, it seems okay, go and sit on that chair. If it may help you, it may not help you. But then when she sat, and after that he told, you have to come back next week to sit again so that you'll have better. But she never came back.
Very expensive
Yes, it's not very expensive.
information.
Yes. And I think a group of doctors can have one chair and tell all the patients to go there and sit. So that way you can get your ROI very fast than energy-based devices. And PRP, of course, it is your choice. You can do whatever it is, since it is an autologous, no reactions, and it can be combined with both. Thank you so much.
Thank you, ma'am. Thank you for this wonderful lecture and for enlightening all of us.